Good morning and good afternoon, everyone, and welcome back to the DASH webinar series. My name is Megan Diamond, and I am the Director of Programs and Innovation at the Harvard Global Health Institute. I'm excited to welcome you here today for our webinar entitled New AI Solutions in the COVID-19 Response, Getting an Idea Off the Ground During a Pandemic. This webinar is the third in a series that is co-hosted by the Novartis Foundation and MIT Critical Data, with the objective to bring together experts from around the world who are exploring the role of tech and AI in the COVID-19 response. And we're specifically focusing in on countries with high socioeconomic disparity or those in low resource settings. I'm particularly excited for today's webinar because we're going to get a really candid look into the experience of incredible thinking, or rather incredible thinkers, who are developing timely solutions for pressing health needs in Africa. Our panelists will discuss how new tools have been developed in the midst of a pandemic and how they transitioned their creative ideas to tangible output. We'll also hear how COVID-19 has changed the innovation ecosystem and why local ideas are often the most impactful. I'm excited to introduce our speakers here today. Unfortunately, one of our speakers is currently unable to join, but hopefully is able to come into the conversation in a little bit. So with that, I'd like to introduce Mike Ahiale, who is a principal at BLEN Corporation and co-founder and CEO of Mogset Inc., a software tech company that produces a complete tech stack for care providers. He has over 20 years of experience working in the tech space and consulted in the private and public sectors, including for the White House and the US Department of Education. Mike is one of the operations lead for the Ethiopia COVID-19 response team, a global volunteer team of over 1,700 software engineers, doctors, machine learning experts, and others who are helping the Ethiopian Ministry of Health and other African countries respond to COVID-19. Today's panel is going to be moderated by Natasha Sunderji. Natasha is the Global Health Lead for Accenture Development Partnerships, an innovative business unit at Accenture that works with leading international development organizations to address the world's social, economic, and environmental issues. Natasha has over 15 years of experience advising multinational companies, social enterprises, NGOs, and multilateral agencies on growth strategy, business model design, digital health, and cross-sector partnerships. She has worked with leading organizations to design patient-centered technology solutions, supported health impact investors develop commercialization and scaling strategies for their portfolio grantees, and advise policymakers on the regulations and investments needed to drive a robust digital health ecosystem. She has written multiple articles and reports on the promise of digital health and the challenges in scaling leading solutions in collaboration with DevEx, the Broadband Commission for Sustainable Development, IFC, and others. So before we get started, just a couple housekeeping notes. We're going to be running a live Q&A throughout the webinar, and at the end, we'll take those questions. And so we've enabled our Ask a Question feature on the bottom of your screen. If you have a question, you can just pop it in there, and we will do our best to answer them. This video is being live streamed through Zoom and Facebook Live, and recording will be made available on the DASH website afterwards. Lastly, this upcoming Tuesday, June 2nd at 9 a.m. Eastern Standard Time, we'll have our fourth webinar, which is a complement to this one, entitled Mature Tech Solutions in the COVID-19 Response, Leveraging What Already Works to Improve Health Outcomes. You can visit our website, dashinafrica.org, for the webinar details and for information on future webinars. With that, I'm going to hand the mic over to Natasha, who will be leading the discussion today.
Thank you so much, Megan. Good morning, good afternoon, good evening to everyone that's on today's call. I'm so thrilled to have you all joining us today for what I'm sure is going to be an engaging discussion on COVID-19 innovation, really with a focus on digital health and AI. I think we can all say that COVID has fundamentally reshaped our world and our lives. It's stretched the operational limits of healthcare with shortages of everything from masks to gloves to ventilators, ICU beds, and of course, healthcare workers. At the same time, it's really shown us the tremendous impact of digital health and AI innovation. That's why I'm so thrilled today to be joined by Mike Ahiale, who's really driving needed innovation in digital health in response to the growing COVID threat in sub-Saharan Africa, specifically in Ethiopia. Mike, thank you so much for being here today. I would love to start by just building on that fantastic background that Megan shared. How are you seeing COVID-19 play out in Ethiopia, and why did you really feel like innovation was needed to address the challenges you were seeing?
Yeah, thanks, Natasha. I really appreciate the time and the opportunity to be able to discuss the work we've been doing with the Ethiopia COVID-19 response team. Every story has a beginning, and let's start there. So this is a couple of days after Ethiopia confirmed its first case. This is March 13th. It was announced, and the health minister there, sent a tweet saying Ethiopia has confirmed cases. And a few days after that, it dawned on a few of us, a few friends, that we have to do something because there would be a capacity issue. And as you know, at that time, I live in the United States, mainly in Washington, D.C. We are in the midst of it. We are experiencing it firsthand. So it became so real, right? We were experiencing, personally, I was experiencing it. I was locked in by then for a couple of weeks with 2 young kids in the house. So it was obvious for us that we have to do something. And as you know, in sub-Saharan Africa, preventing the COVID from spreading is more important than trying to mitigate it later on. And partly because of capacity issues, and this is true for all African countries for that matter. So sent a single tweet saying, hey, hackers out there, let's get together and build something. And really the idea behind it is to see if we can get a handful of people, make it like a weekend project. That was the idea, the original idea. And what it turned out is in the first 24 hours, roughly about 300 people showed up. And I didn't expect it. And these are some of the most amazing people that I've never met, but turns out they're great folks. And everybody said, what can we do? And that's how the beginning of the story. So fast forward 9 weeks, we're 1,700 people. These are machine learning experts, software engineers, medical doctors, marketers. And what we learned over the last 9 weeks is the insight that we've gotten early on is COVID response is actually, it requires a whole slew of solutions, right? And you have to identify the right type of tooling in the right type of context, right? And as we have the conversation, we're going to dip, but that's the origin story for our effort.
I love that it started with a single tweet. It shows the power of just that one message and galvanizing a slew of diverse stakeholders to come together to respond to something so critical like COVID.
Yeah.
I could imagine that it was both fantastic to bring together such diverse stakeholders and skill sets, but I could also imagine that may have caused some challenges along the way. Help me understand, why was it important to bring together these diverse stakeholders, and how has this really helped and hindered your success?
Yeah, so these different stakeholders were necessary in order to understanding what the problem set was in itself, because as you respond to a pandemic, one of the things that becomes obvious to you immediately is there are imperfect set of requirements, and people generally don't thrive. Like they need a set of requirements to work against, and our experience has been to work from these imperfect set of problem sets and try to derive a solution. So it's been challenging, like ramping up a group this big, this quickly was challenging. So, my orientation in software development and the early people who joined had the same intuition. So we turned to tech solutions, Slack and Zoom and these type of solutions to just quickly organize. And my background, and also some of the co-organizers right now, we have background about community organizing in different capacity. So that came in handy to make sure that we are able to create a decentralized group without any, real structure, so that we allow creativity to flourish very quickly. Because we felt early on that it was important that we shouldn't dictate it from top down, but allow the individuals to be able to organize themselves. And that's been true, that's been working out very well. Another important thing to mention here is that there was already an ongoing effort by the time we sent that tweet on the ground in Ethiopia within the government. And that was a little bit of luck and a little bit of, karma, being understood by the universe. And in fact, because of that underlying effort, we are quickly be able to get attached and be able to break down the bureaucracies very quickly, right? Because it's very challenging to actually come up with, as an outsider who has not been in especially the global health space, to be able to break through and offer solutions very quickly. And it's a little bit of luck for us. There was already an effort.
Yeah, I love what you said there. One, trying not to have a top-down approach. I think that's a fantastic learning when folks are trying to drive new ideas and get them to scale. And the second thing I heard there was that ability to tap into a network of individuals who are on the ground and already responding, to ensure that you weren't pushing solutions that may not necessarily be applicable to the context in which you were working. Help me understand, how did that connection really come together? And was it just with other technologists on the ground and innovators on the ground that shared your passion? Was there some level of connection back to the government to ensure you were driving new solutions in response to their priorities as well?
Yeah, it's a little bit of both. So there are many stories about this experience, but there are a couple that stick out. So in the early days, as we go through this, one of the early things that happened was get connected with the local ecosystem, the tech ecosystem on the ground. And obviously everybody felt, something has to be done. It's not clear what needs to be done. And the government, especially at that time, the Ethiopian government was still trying to figure out the strategy, how to, how to embrace this type of new volunteer group, but more importantly, how to actually respond to COVID-19 internally as well. So making that work, it was, required a ton of conversations and making sure that I cannot tell you how many hours we spent to actually whiteboarding this thing to death. And there was a local company, a local startup in Ethiopia that has an existing network that we relied on to be able to understand what was going on the ground. And it's an important lesson that it must be said that at the end of the day, whether there is a pandemic or not, this is a human enterprise, right? So all the technology needs to be contextualized and it has to be adapted for them to be any use, right? And for us, it was super important early on to be able to contextualize all of the solutioning that we come up with within the ecosystem that's already existing, because it became clear very quickly that the rip and replace approach is not going to work, right? Especially in a country where it spent the last 2 decades building out this health infrastructure to respond to HIV/AIDS and other types of, getting ready for Ebola and that sort of stuff. It was important to be able to just get tapped into that existing ecosystem, because it's not no one organization, no one team, no one government would be able to respond effectively. It has to be a collaboration across multidisciplinary folks.
I couldn't agree more. I think collaboration has been critical to all of the digital health solutions and AI solutions that have gotten any level of traction. Let's get tangible. Describe some of the solutions that have emerged from this COVID-19 response team, and what has been the real impact of those within Ethiopia?
Yeah, sure. So the way we organized ourselves in the early days is into multiple work streams, right? And some of the work streams, so majority of the work streams are technical solutions, because we felt that was one thing that we can do from outside, right? But secondly, that's something that is our orientation, is just so natural to us. But the other thing that we learned is, outside of the technical solutions, you have to also think about marketing. So the way we thought about awareness that the importance of hand washing and any type of these things as a marketing effort, right? So it was not any different than how I run my marketing in my startup. So we put together a team of marketers who have done experience in running Facebook ads and be able to message certain things in a certain way. We talked to the Ministry of Health in Ethiopia to be able to, agree on a set of messaging, come up with some sort of approval process, and be able to ship out. So the early estimates right now, it's still early. We're in a little bit of a fog of war. So the marketing team was able to reach roughly about 10 million people with this effort. And there's another work stream about delivery, because when people come into the country as a quarantine, if they don't have the means, how do you cater for them, right? These are challenging things that the government cannot do by itself. So we have to ramp up very quickly a set of team to be able to deliver healthcare workers and medical devices and civic engagement and diaspora. And there are a few moonshot projects that we're doing around data, about data analysis, to be able to predict when the next cluster happens using the existing data. So these are the different areas that we've focused on. And tangibly, at the end of the day, it would be hard to identify, at least at the moment, to outside of these cursory numbers, like 10 million people reached by the marketing folks. The product that we built are these 10 purpose-built, fantastic products that we believe are, and they're built very quickly in a span of 4 weeks. And so we have this, but we have to just wait until the full impact to feel the full impact of these products. We think right now, at the very minimum, we did a couple of things right? So one is because of the early work of the volunteer team in conjunction with the Ethiopian government, other nonprofit organizations, startup ecosystem in Ethiopia, the awareness and the in-country awareness is actually pretty high. I will tell you one good example. So in the early days, this is like a few days after the volunteer team was assembled, the Ethiopian government came up with this idea of changing all ringtones when you call out, all ringtones to a short message about awareness. That was a clever move, right? So that single act, we think that has an impact, disproportionately large impact, because there are billions and billions of calls being made every day. And instead of a ringtone, you use that 10 seconds, then that 8 seconds to be able to, relay a PSA, a quick PSA to the society. So there were like these type of very creative, low tech and but very high touch solutions that are introduced as a result of this. And I think COVID has, accelerated the adoption of these type of creativity and digital tools to be used across the group. There's a lot of work right now being done around e-learning, right? How do you do education and distance learning? And within the context of Ethiopia, it's very important, right? Because a large portion of the society doesn't have access to education. So this may actually be a Trojan horse for a larger transformation to happen across country.
I love that example of changing the ringtones. And I think the point you made around low tech, high impact solutions is so important. All too often we over-engineer solutions, and some of the most impactful solutions don't require a heavy amount of tech and a huge amount of investment. I think the marketing work that you've done and the 10 million people you've reached in just the 4 short weeks is a great example of how you can have impact in such a short period of time. I'm curious, I would love to come back to that moonshot that you highlighted a little bit earlier. I think you mentioned that you're trying to use some of the limited data that exists in order to predict potential outbreaks. Yet we know data is a perpetual challenge, particularly when we talk about sub-Saharan Africa. How have you been able to navigate that?
Yeah, it's a challenge. So the data challenge is actually a problem across the globe right now, because sometimes even in the US, for instance, the challenge with understanding, making sense of the data, the glutton of data that comes in, and making sense out of it has been a challenge. So the way we approach the data challenge is by solving for the specific points of the data collection. That's because at the end of the day, garbage in, garbage out. And our attitude was, can we engineer a solution that's so simple to use, but yet effective? And what we found out early on is web applications, actually web forms, that sort of stuff may actually be a little more detrimental and actually be effective within that context. So we turn our attention to building messaging bots, right? So we use messaging bots as a way to collect data on the ground. And we built a set of messaging bots. One was for awareness, another one for data collection, another one for healthcare workers to be able to educate them, but also to use it as a symptom tracker for these healthcare workers. And all of this, the culmination of all of this data will be piped into a single platform, and you will be able to make sense out of it with a single dashboard that we've built and we open source. And one of the important things that we understood, and it becomes obvious very quickly, is because of these, so two things are at play. One is the availability of smartphones is not as widely adopted in a country like Ethiopia, but there is some availability of phones. But the other important thing worth mentioning is we had to figure out how to, within that context, even they have a smartphone, it was important for us to be able to give them the tool that they know how to use, right? So, and this actually is going to be true across Africa for that matter, that messaging tools are going to have a disproportional impact on these type of effort. And Facebook understood this early on, and the Facebook WhatsApp group actually came in and helped built out the official with the help of WHO. And we understand that moving forward, the partnership that we need to make in some of these efforts it's an asymmetry type of relationship that we have to make. Technologists on one side, public health officials, and government bodies. Those three are the way to move forward, right? Because it's been very effective, super effective about these tools.
No, I love that idea of leveraging tools that people already know how to use. A pandemic is not the time to over-engineer. It's not the time to try to train up individuals on net new tools. You're not likely to get scale. And so I love the fact that you've really honed in on this point, which I think could help guide others as they think about some of the innovations and ideas that they can bring to scale.
Yeah, and it's also important to understand that. So the data analysis part is, it has to be done in order to be able to predict safely, and you want to be able to extend your number of, because in cases like Ethiopia, especially in the early days, we were not testing. The country was not testing. There aren't enough tests in the country. So how do you use machine learning, for instance, to be able to accurately predict where the next cluster would be? It's super important to be able to extend the number of tests you have. Your ability to be able to understand exactly exactly what the population, the shape of the population is important. So in Addis Ababa, for instance, the city, the capital city of Ethiopia, there are roughly about 6.5 million people. And the local government was able to do a survey, a door-to-door survey of all its residents in 3 weeks, right? Which is such an important data set by itself, right? So data governance is an issue. So that's another important point. Security is another important issue. So how do you mask the PII? All of these things are in the nascent stages, and it requires a certain level of engagement and conversations with the stakeholders. And so those are the early learnings that we had about this as we respond to COVID-19.
Fantastic. Well, I see our other panelist has joined us. Darlington, thank you so much for joining. For those of you on the call, Darlington is a global leader in the field of AI. He is the founder and director of artificial intelligence at Udra, which is an organization based in Ghana, whose objective is to solve Africa and humanity's grand challenges using exponential technologies. Darlington, thank you so much for being here. I believe you had a power outage earlier and it may go out again, so we'll do our best to pull you into the conversation when we can have you.
Thank you. I apologize for that. It was really horrible. Yeah, but as engineers, we have to solve problems. So I think I managed to find a way to get myself online. Yeah, I'll see how long I can stay before I run out of power.
Perfect. Well, Darlington, we were just having a very fascinating conversation with Mike that really focused on data. And I know that that has been one of the big challenges that you've been trying to solve for in Ghana, which is where you've been focused. Talk to me about the data gaps that you were seeing and the dashboard that you tried to create in order to help guide the local and national response for COVID.
Yeah, so early on when the COVID-19 cases were recorded globally, there were a number of dashboards that were created. We had the Johns Hopkins University dashboard. The challenge was that even though they tried to cover as much places around the world and they did collect data on Africa, they did not give us analysis of data specifically in Africa. So you could get the global perspective of what is happening in COVID-19. You could get the perspective of what is happening in China, but that whole truly understanding what is happening in Africa did not exist. So even before Ghana recorded its first case, we decided to put together a dashboard. And also they had the challenge of inaccurate numbers. So we decided to put a dashboard, put together a team of, I think currently we are a little over 60 or something. And then these people work daily, monitoring data from across Africa, different countries, trying to ensure that we always updating our dashboard. It's not perfect, but yeah, we've been at it for a while now. And sometimes there's a lot of conflict, even with the Ghanaian data, for example. You see the official numbers go to a certain point and then they, for some reason, reduce. We had this happen yesterday. And so you try to find out what happened. You have to go look at the news and try to understand, was there a mistake? So yeah, there's a lot of efforts on that end. So yeah, maybe somewhere even in the conversation, I can show some of the dashboards we've been able to, we put together and then analysis we've been able to do.
Yeah, I think that would be fascinating. I'm curious, you talked a little bit about the data challenges, how you really have to dig into the numbers to actually understand what may be going on and to correct where needed. How is that data being used?
Yeah, so we've been lucky enough to have thousands of people visit the platform. We've engaged a number of stakeholders, a lot of discussions, even with journalists. We've been able to do this with some of the data that we've collected. But more importantly, one thing this data is allowing us to do is to be able to have projections. So we've been able to have a log analysis, log scale analysis, comparing Africa with other parts of the world to see what is happening, because there was a delay between when the first cases were recorded in Africa compared to other places. So we try to see the similarities to try to project what is happening, as well as use statistical time series forecasting approaches. The interesting thing now is that the official facility that is responsible for testing in Ghana has reached out, and then we engage in each other as far as having more work being done for the nation as far as a projection is concerned. Because I think that is probably going to be the most important thing going forward now, because everywhere people are accepting that we will need to reopen our countries. We can't stay locked forever because we are quite far away from a vaccine. So Ghana, you're already having discussions about opening schools. It shouldn't just be, I think we should open schools. It should be based on data. So what are the projections if we open school? Instead of just broadly looking at opening school, if we ask the question that, okay, if we make schools run in tracks, how would that affect the spread? As opposed to if we let all of them open, if we restrict this number of people in the school at a time, if we supply max. So we need to be taking data-driven decisions. And so this data that we've been collecting is allowing us to start doing some of these projections, and we are happy to start working with the authorities in this direction. But it's still very early on, so.
No, I love that idea, data-driven decision-making and driving policy based on data and playing out those different scenarios. You talked a little bit about your projections work and how you were comparing what was happening in Africa to what was happening in the rest of the world in order to be able to draw comparisons and predict what might happen. I think one of the criticisms that has come up is that a lot of the models that exist in other geographies are not as applicable to Africa. Is that something that you experienced as you were trying to model out different scenarios for Ghana?
Yeah, not to throw any shade at anyone, but actually, and I do work with UN, even though I'm going to say this, but most of the projections that were even made by UN about what is going to happen in Africa, and even the Gates Foundation, were way off. We could still say it's too early to say it's way off, but at least the projections and then the time that were associated with it has been way off. And from what we've seen, so the advantage of doing monitoring or analyzing different countries based on log scale is that if you start like we did, I think I could just share this. Oh, I can't share my screen, maybe later. I think it's disabled, but then you realize that if you take from the day that the first 100th case was recorded in a country, and then you compare it between African countries and the other countries around the world, US, France, Italy, and all, China, you realize that there's a vast difference. The curve look nothing alike. They are so far apart. And there's a lot of speculations as to why this is different. And I think that's even an interesting discussion. So I think for those of us data scientists, the next question will be that can we properly answer why the virus is not spreading in Africa the way it's spreading in other parts of the world? And even though people projected that we'll have the worst case, why don't we have the worst case? We've discussed this long enough, and we have some theories. Some of them are quite concrete, but it would be nice to put it all together into some concrete thing to help us truly understand if we are truly safe. Yeah.
And beyond just data and the dashboard, which I think you've described as being leveraged for policy making, you've also tried to drive greater innovation for COVID-19 response efforts through a hackathon. Though from our discussions, it kind of came together in a very unique way. Can you tell us a little bit more about the hackathon, how you really pivoted to COVID-19 and some of the solutions that have emerged from that?
Yeah, so what happened was that, so we have a Rand Miller AI Institute where we train people in AI. We have a community. We're starting a fellowship program to help young up and coming data scientists. So we're organizing a hackathon. We organized this and we're hosting it at West African Center for Cell Biology and Infectious Pathogens. So yeah, we were just going to host this there and then have a nice time analyzing some sort of data. So far apart from COVID-19. But then when COVID-19 became a major problem, it had not yet been in Ghana. So we decided that, hey, in preparation for this, why don't we change focus? So I remember having a conversation on the March 12th with some of the directors of the biomedical facilities in Ghana. And I said, hey, why don't we mobilize? So we are doing AI and we're already going to do this. We can mobilize it towards COVID-19. And then they said, well, actually, we don't have any cases in Ghana, but and the tests that we've done so far, they are all negative. And I said, yeah, but let's not wait. Funny enough, that same day after that conversation, we recorded our first few cases. So what we did was that obviously we couldn't have the hackathon in person anymore. So we relocated it online. And eventually what we went ahead doing was being able to detect COVID-19 related abnormalities as far as the chest is concerned via medical images. So in our community, we had a few people that decided to take up the challenge of developing computer vision models to be able to detect this via X-rays and CT scans. And so we went ahead with that. We had some impressive results. The data we had was quite small at the time, but there was just proof of concept. So we're able to get some results that were what I think in the 80s as far as percentage. So yeah, that was impressive. But this is best used for triage. A number of countries have attempted using this to primarily detect COVID-19, but from what we are seeing further studies, it seems there's a lot of issues along those lines. So it's best used for triage. And so It's good that we have some solutions that are very useful today, like the data analysis and comparing it, understanding projections. But it's also good to have certain solutions in case things really go south. So currently we have a lot of mild cases in Africa. We have way more mild cases than even other places as far as the ratio is concerned. We don't know yet when the critical cases will start to increase. Maybe our aged population have not yet been affected yet. Once it hits those groups, maybe it becomes an issue. Once it gets there, triage will become important in deciding who should get critical care as soon as possible, because we'll soon very much max out our capacity when it comes to intensive care. So yeah, the proof of concept, since we worked on it, we'll put it on the side. Once we have the need for triage, we'll roll it out again, but yeah.
That's fascinating. It sounds like through some of the innovation work you're doing, you're not only trying to respond to the immediate needs, but kind of project out into the future what may be coming down the pipeline and making sure that some of the critical thinking that's needed is already done in advance, so that you're ready when the time is right. I'd love to bring together the two conversations, because I think, Mike, in our discussion, as well as in our discussion in Darlington, you've brought up a number of really interesting learnings that has allowed your solutions to really get some level of traction and really get off the ground. I'm hoping you can spend a couple of minutes really summarizing that for those that are on the call. What are those learnings that you have for other innovators who are working to get their ideas off the ground in response to this pandemic? Mike, perhaps I can start with you.
Yeah, majority of what Darlington said is very true. It's also applicable in Ethiopia as well. And there are different ideas that are being run around on why, the number of cases are not going fast. Now, the only caveat that I would add to this is in the last 10 days, the number of cases in Africa went up by 61%. So they're not in our favor right now, right? The numbers are increasing quite high, and the response needs to be a little more targeted and a little more intentional as we go through this. When it comes to like the solutioning part, and as I alluded to earlier, there are a series of products that we thought would be necessary to be able to do this. So we start solving for the data collection part. So we built an API, we built these bots all over the place and all of them are open sourced as an Africa COVID-19 response toolkit. There are the vacancy bots that we built for healthcare workers. And as we ramp up these things and the understanding how some of the data, the incoming data from these tools, to be able to make sense out of it, we organized a team of machine learning experts to be able to look at the data and start, making some prediction, like Darlington said. And the insight that we're getting right now is, the female population is getting hit disproportionately, right, in the last couple of days, in the last 10 days or so. And that may, the conclusion for that could be, community spread is going a little higher than at least the community spread. It's going up. In Ethiopia's context, there are certain projection that needs to be made around that, certain adjustments. Some of the products that we built around the awareness communication, we're seeing that it's being shared with the local folks. They're getting printed. It's actually quite interesting that you never think that a digital ad on Facebook can be printed and shared across the population for those people who don't have access to it. So these are the important lessons that we've learned. And all of these, like I said, it's going back to the original point I was trying to make, is the products have to be able to fit within the existing ecosystems, right? Those are the important early learnings that we have. You cannot come in and be the hero here. The idea is to actually work with the existing ecosystem and be able to, connect with people like Darlington in Ethiopia's context or other African countries, and to partner with them so that the capacity can be built, right? So those are important lessons that happen early on that I think would continue to be true as we expand to, from Ethiopia to Kenya and other African countries to get these products adapted.
Great point. I really love that idea of fitting within the existing ecosystem, and a lot of the examples you've shared in our short time together really highlight why that's allowed you to be successful. Darlington, same question to you. What are some of those learnings that you have for the innovators that are on today's call that are working to get ideas off the ground? What has allowed you to become successful? Oh, we may have lost Darlington.
Yeah, connection could be an issue.
Hopefully he's able to join again and we can bring him back into the conversation. I'm starting to see some of the questions coming in from the audience. Perhaps I'll take one right now that's directed to you, Mike. You had mentioned 10 products that the response team has developed. Do you mind going into a little bit more detail around what those solutions were and how you decided to pursue those specific products?
Yeah, sure. The way we approach, like I mentioned, the way we approached it is we mapped it out. We mapped out what a COVID-19 response would look like, right? And we bucketed it into a few important areas. One is an outreach, which is an awareness effort. The other one is the surveillance and analysis of the data. Then the other bucket is what do you do with these patients that are isolated, suspected cases that are in quarantine. The other bucket is the healthcare workers. So in these four important buckets, we just start looking at what's existing available, and whenever we see that the product is not available, we just built it. So one good example for awareness, for instance, we noticed early on that every province, every local government, even the federal government was in the process of building their own website to be able to share the same set of information that the WHO guidelines and so on and so forth. So we're web designers, right? The team of web designers. So what we did was we built a turnkey website for if you want to spin up a quick awareness site, all you have to do is just fork the code from GitHub and be able to quickly translate it to your local language, and you have an awareness site up and running. So all of the complexities of building a website and making it optimized for mobile, all of that technical things have been abstracted out so that we can save you time to focusing on delivering the content, right? The other thing, for instance, is internal operational dashboards. We saw it early on that, okay, you have the data, you collect the data, what do you do, right? Now, you can come up with a very complex solution to be able to understand the data, but what we did was we open sourced, we built a dashboard that you'll be able to quickly pipe in any data to it. And because of these purpose-built applications, what they do is they just start making sense of the data immediately, right? It looks at COVID per day, the number of cases that you have per region. It starts breaking down into such an operationally efficient data sets. So the dashboard can be, you don't have to build it from scratch. If there are any customizations, the open source code, you will be able to modify it. Surveillance forms is another important effort, right? How do you have a standardized, so WHO publishes a guideline on what surveillance form is gonna be, but really converting it to an actual web form or a bot is a technical challenge that it would take you maybe a week, right? So in order to compress that time, we built a set of these surveillance forms and we shared it back to the community so that they can be translated. And language is an important barrier here. So we're very cognizant of, we're using standard libraries and stuff like that to be able to translate. The same thing with, I keep going back to the bots. SMS messaging is another product that we've built. How do you build all of these built products? How do you deploy them to the cloud, right? That's another technical issue that you want to get past. So for that, we built a set of, with partnership with AWS to be able to quickly deploy it to an AWS cloud or something. And another important thing that came about in the last several weeks is the diaspora. We're finding out that the diaspora community in the US and in Europe is actually impacted by COVID-19, and this is true for, and the CDC data bears this out. It's important that the socioeconomic of the group is also impacted. So in some ways, this is a connected effort that some of the tools that we've built for Ethiopia are now being used in the diaspora community in the US, which is such, it just makes it a full circle effort in that sense.
That's
So
fantastic.
yes, these are some of the 10 products that we've built. And again, they're on GitHub, they're open for free to be used by anybody.
No, I love the fact that you've made them open source so that they can be leveraged by other countries, other populations. That's fantastic to see. One of the questions speaks to the fact that many of the innovations that are emerging in the light of COVID, and even many of the solutions you've described today, are in the pilot stage. How do you make sure that they are actually improving health outcomes, and how are you working with key stakeholders to evaluate those tools?
Yeah, it's hard to say. I completely agree. It's a shot in the dark sometimes. One of the things that we're doing effectively, I believe, is we're using best practices to an extent possible. We're using all of the best practices that are available based on the resources that are available, and to an extent possible that these are built in conjunction with epidemiologists, medical doctors, so that it makes sense to them, because we're not domain experts in that sense. We understand the data, we understand what to do with the data, we understand how to analyze the data, but to contextualize it to the specific domain requires a certain level of experimentation. And this space, and as we learn more, the health space actually has not done a ton of experimentation in that sense, right? And this is another opportunity, was giving us another opportunity to look at how global health can be delivered by marrying it with how you build an app, right? Effectively, how do you merge these things, and how do you make small experiments to see the efficacy of some of these tools? But I agree, we're still early in the process, and it would take time for them to shake out the actual impact.
Makes sense. And I see Darlington is back. So perhaps this next question is to the two of you. As the work progresses on COVID-19, are there conversations about other diseases that continue to impact people during the pandemic? And can you see an opportunity for some of these tools and approaches to be repurposed one day to fill gaps in those diseases? Darlington, perhaps I'll start with you around that question.
Yeah, so definitely a data-driven approach to dealing with pandemics, or dealing with just diseases, viral diseases in general, is very important. As a matter of fact, we know about the story of an AI system being one of the first to actually notice that COVID-19 was a viral disease that started spreading in Wuhan. So yes, I think as more countries adopt these approaches to monitoring and surveillance, with the right frameworks, regulatory frameworks, once we adopt these approaches of monitoring different factors at the same time, and then analyzing it to see if there's any pattern, we once we are in that position, we will be able to better deal with more of these viral diseases. In all honesty, if maybe we had done this earlier, maybe things wouldn't have escalated to this point. So yeah, I think if there's one thing that is quite clear now, is that digital tools are completely essential, both to dealing with this sort of pandemics, but also even still keeping the economy running if there are any sort of issues like this that have us all under lockdown. So yeah, that is one thing that's, I think, is possible. We can repurpose a lot of these digital tools, and obviously AI for triage and all sort of other things mentioned, or just digital health is of course very important. It's scalable compared to traditional healthcare approaches. So yes, there's a lot of repurposing that can happen.
I think the three of us are probably tech evangelists. So we've probably been talking about the need for data-driven decision-making and the promise of digital health tools for many, many years. Have you seen that mindset change within specific stakeholders that gives you hope that things will actually fundamentally change post-COVID? And if so, who are those stakeholders where you've really seen that shift in perception and mindset? Maybe Mike, I can ask you to respond to that.
Yeah, it's actually there's an internet meme that's going around that says, you know, the single most important digital transformation tool in history is COVID-19, right? Because every government agency, every organization, just have to come to grips with what we've been saying for I don't know how long, 20 years, 25 years, and it's very true. Now, I'm very hopeful that this is going to continue. That, like Darlington said, the idea of data-driven decisions to better health outcomes would, you know, continue to play pivotal as after this pandemic passes. And my hope is it becomes, I think for most of us who start, you know, responding to COVID-19, what's going to become obvious to us is, as you look at some of these tools being built very quickly, almost in the cost structure never seen before, right? And the ability to be able to galvanize a network of people to actually do it together and openly in public is such a different mindset, and seeing it impacting, you know, a farmer in Ethiopia, or, you know, healthcare workers in Ghana, or like I said, at the end of the day, it's about touching the people on the ground. And this is the human enterprise is such an important thing, at least for me. I think the connection between these two would be a game changer, in my opinion, right? Because government officials no longer think that this is a luxury, right? The digital economies is one of the things that Darlington mentioned. And in the first, I think, couple of weeks of COVID-19 was announced in Ethiopia, for instance, this is just an example. The federal government there passed a law allowing contactless payments in the country, which is a first, right? These are the kind of things, concrete things that are happening in Ethiopia. I cannot tell you how many of my friends have been like advocating for fintech to be a core of the you know, the Ethiopia economy. And just because COVID happens, I don't know, in a span of several weeks, the law was drafted and it got approved in Parliament. And this is very happening every single day. I have a friend, we have, you know, a couple of volunteers in the group that are building delivery solutions similar to Uber Eats. It's called Deliver Addis. His name is Falag. And his business is now booming because of the infrastructure that he laid out all of those many years ago, right? So we're seeing these digital transformations are happening where we hope and we believe that they are here to stay. And I think it creates another third wheel to the economies as we go through, for these economies as they come out of this, maybe much more stronger than before. So I'm very hopeful in that sense.
Yeah, two really interesting things I heard in there. One was how quickly regulation has been put in place in light of COVID, where that's always been called out as one of the biggest barriers to actually getting scale to a lot of these digital health and AI solutions. So I think COVID has really proven that if there's a will, there's a way. Yeah. These timelines don't necessarily need to be the big detractor that they have been to date. The other thing I heard in there was the kind of investment in infrastructure. One of the questions that I've come across highlights that a lot of the tools that we've been talking about around digital health and AI rely on internet connectivity or electricity, which isn't always available everywhere. And how has this been a barrier so far? And what has been your thinking about this? Have you seen a shift in government and other stakeholder perceptions around the needs to invest in this?
Yeah, so one of the things that we are cognizant of is like the availability of internet in Ethiopia, for instance, is very low in the teen, you know, it's very low percentage of penetration. So all of the products that we've built have to be offline first. Like we don't have, there's no luxury to actually think that the internet is going to be available, nor reliable for that matter, right? Even in the areas of availability. So it required us to think deeper. There's a local company in Ethiopia that has been a champion, that has a different satellite backbone to actually try to see how the data delivery can happen without internet connectivity. So there is a lot of innovation that needed to happen within the context of the country that to make sure that this thing works as if there is no connectivity, right? So it's a spoken hub model where all of the devices that these things get installed for data collection especially can happen. So you'll be surprised it's not hasn't been as a barrier as you would think that it would be. It's just, it has to be built for contextualized to the country that we're building it, right? And these offline first solutions oftentimes yield same number of results that you would want with the internet connected. But I agree, that has to improve as well.
Yeah, I think from our end, it's I was laughing when you asked the question because I've gone off and on the call because of the two things you mentioned. So yeah, that basically kind of answers the question. It's been a major issue in Ghana and in a lot of places, not just Ghana. Once there were a lot of people now having to rely on digital tools, we realized that the infrastructure we had as far as internet connectivity was not good enough. It couldn't take all the people. So I remember even the telecommunication companies sending out a letter asking people that use the internet less, please, which was quite funny. But yeah, there was this conversation with government along the lines of how they could make it easier for the telcos to be able to provide more reliable internet to people. And then as far as electricity, this has been horrible today. But then at least one good thing the Ghanaian government has done was that they provided some sort of bonus. So in Ghana, you buy electricity, but they provided a bonus based on some long period, and people got a whole lot of bonuses that allow them to use the electricity for a very long period without having to pay. So that was a good initiative because once we were on lockdown, most people couldn't work. So definitely, where would they get the money to afford electricity? Now a lot of people got the bonus for the electricity. However, the issue was that there was still they couldn't get it to be reliable all the time. So that has definitely been an issue. I think that's even beyond COVID-19. That has been one of the largest problems in Africa, energy. And yes, this COVID-19 has really established how that's quite a serious problem. I would like to see how better we solve that. I like that Mike mentioned edge solutions that do not require internet connectivity, which is great. But then also there are a lot of solutions that even if they are edge and they don't require internet, at some point they'll require internet. Either people getting it off the internet to whatever device be able to use them, or sending that data back to you so that you'll be able to analyze and then make a lot of decisions. If we want to be able to make data-driven decisions, we should be able to collect data from different points as quickly as possible and make decisions quickly. So there's no way of getting around solving that internet connectivity issue. I know there's a number of projects that are trying to do this sort of low orbit, I think it's low orbit satellite internet, which is promising. But yeah, so let's see how that goes, because this has been horrible. We have a lot of solutions, especially in AI. We are dealing with data sets that are probably in the hundreds of gigabytes, and you can't get stable internet. That is really painful. I'm not going to lie about it.
Well, our hour has quickly come to an end. I am so sorry to cut you off, Darlington and Mike. I'm sure we could have spent another 4 or 5 hours talking about the kind of infrastructure investments that are needed in order to really get a lot of these ideas off the ground, get them to scale, integrate them within the broader ecosystem of innovation that's happening on the ground to ensure that they're fit for purpose. But just wanted to share a huge thank you for your reflections and your insights and helping the folks on the call to really understand how you really kind of pull together a diverse group of individuals to spark innovation, how you really get ideas off the ground, how do you really get them to scale for the pandemic response, and even some really interesting insights of what may come post-COVID in light of this. So thank you so much. With that, I will turn it over to Megan for some closing remarks.
Great, thank you so much, Natasha, Mike, and Darlington for your participation in the panel today. Like I said in the beginning, I was really excited for this discussion because I knew it would be grounded and candid, and that's exactly what it was. And if we're looking for a silver lining in all the webinars that we're doing, in many ways it feels like we're all sitting in the same living room and just having a conversation about the experiences, the challenges, and the opportunities. So I thank you, all three of you, for your time and your flexibility. I know time is not a lot around, so definitely appreciate that you gave us yours today. So just wanted to thank our audience as well for coming on to the call, or webinar rather, submitting thought-provoking questions. And we hope to see you on Tuesday, June 2nd at 9 a.m. for our next webinar, Mature Tech Solutions in the COVID-19 Response, Leveraging What Already Works to Improve Health Outcomes. With that, have a wonderful afternoon or evening wherever you are, and take care of yourselves and others. Bye.
Thank you.
Thank you.